Hello, beautiful ladies. So today I would like to talk to you about pelvic girdle pain. Up to 1 of 5 women may be affected by pelvic girdle pain, and that can come in a mild or acute way. And pelvic girdle pain usually is a term given to a pain experienced um, in the pelvic girdle area, and it usually can be either at the back in the sacroiliac joints or at the front in the pubic symphysis, although it can be felt throughout your groins, your thighs, and also in the pelvis area, and also in within. So it can come at the beginning of pregnancy and then disappear, alleviates in late pregnancy, as well as you can be affected in postpartum. So even if you didn't experience it during your pregnancy, you may have some pelvic girdle pain after birth. And this is caused because the hormones affects the ligaments, giving so much more mobility to the joints. So what happens is we may feel so flexible during our pregnancy, and we don't want to stretch more than our standards, going more than our comfort zones. We want to stay safe because this can cause instability to the pelvis. So basically, what I would like to tell you is that yoga can gratefully help you in this, because it's going to give you postures adapted to the way you feel so that your pelvis feels stable and safe. And also, you can increase the muscles all around your pelvis. So your pelvis muscle floor, your core muscles at the front, your back muscles, your legs. So everything is actually involved and united together. And there are certain position or certain habits that you want to avoid. For example, very wide or deep lunges, you don't want to do them, or standing with wide legs, or sitting with wide legs again. So maybe adapt a kneeling position, having blocks underneath you if you're sitting on the floor or on a mat, or having a chair or a birthing ball. And also no jumping and no stepping with impact. Of course, I'm not imagining that you start jumping while you're pregnant, but sometimes you want to reach somewhere faster, and you may impact this way of moving, and so that's going to give instability to your pelvis. So you want to avoid that. You want to avoid even walking sometimes can be very, very painful because it's a weight shift, and having also your legs in a symmetry, that will causes the pain as well. And also there are other ways that you can maybe assess your pelvic girdle pain, seeing a physiotherapist or an osteopath. That can give you greater benefits because it's going to really allocate the pain, because sometimes women may confuse pelvic girdle pain with lower back pain or sciatica, which are two different things. So if you have pelvic girdle pain, you want to do something about it as soon as possible, because you want to really live your pregnancy with ease. And especially when it comes to going closer to labor, you don't want to add something else, especially for first moms who never experienced labor and is like, entering into the unknown. You can also prepare with breathing techniques, postures, and mindful awareness, although you wouldn't want to add something else because that can create stress and anxiety. It's almost like going to an exam, having studied for that exam, but you have headache as well. So it's something on top that you don't want to really deal with. And that's true. So we would like to go into labor and having no pain to start with. Of course, during labor, we may feel some discomfort or some pain that we didn't experience before, some waves or some contractions, and those can be dealt with in a not stressful situation, not with a stressful mind, but welcoming them. And of course, yoga can help you during doing this, but also you don't want to come with pelvic girdle pain in a very acute feeling, like acute pain. So see if you feeling any discomfort around the pelvis, around this area, and maybe address it to a physiotherapist, to your midwife, and see what you can do about it. And also knowing that I can help you with that with my pregnancy yoga classes on Saturday. And one more thing, I really want you to enjoy your pregnancy. You're not here to suffer with your pregnancy. You're not here to have all the symptoms that you can have within your pregnancy. There are many things out there that you can do, that you can incorporate into your daily life, because pelvic girdle pain doesn't have to be with you. You can do something. I've had women coming for the first lessons maybe when they were 19 weeks or 20 weeks with pelvic girdle pain. And by consistently showing up to the classes, they didn't have any pain at all. At all. And sometimes they wouldn't come to a class, maybe they would skip a couple of classes and felt uncomfortable again with their pelvis. And as soon as they came and they show up, they felt much more comfortable. So I really, really recommend to do something about it, because yes, it can be a miracle. You can see as you want, but there are things that can help you with pelvic girdle pain, so you don't need to suffer. And I hope you really enjoy this video that helped you, and I wish you all the best with your pregnancy and hope to see you soon. Lots of love to you and to your baby.